if you have esophageal cancer, location is very important. If it's in the neck, usually we don't operate them. Most of those patients need to get chemotherapy and radiation. If it's in the mid-chest and located inside the tube, then usually the patient will get surgery. If it's only located in the inner lining, which we call mucosa, the patient can undergo endoscopic procedures. But if it invades the muscular tissue, then the patient may need surgery. In some of those cases, if there is an involvement of the lymph nodes, we first give chemotherapy and radiation and then wait for about a month, and then we do the surgery. And if the tumor is in the abdomen, which is the most common case in the Western world, it's called an adenocarcinoma, which tumor that originates from secreting glands, from the glands. And in case of an adenocarcinoma, the esophagus, the stomach, and the tumor is usually located just at the junction of the stomach and the swallowing tube. So in those cases, again, depending on the extent of the tumor, the patient may undergo surgery or sometimes chemotherapy, radiation, and then surgery. There was a very recent study called the CROSS trial, which was done in Netherlands with a group of patients, which showed that if the tumor is in a stage where it's reached the muscle layer of the esophagus, swallowing tube, even if there is no lymph nodes involved or not, if the patients get chemotherapy and radiation, the radiation dose is slightly lower than the standard, the patient has at least 10 to 20% survival advantage in long term. This is very significant. So our new standard approach for esophageal cancers in an intermediate stage is always administering chemotherapy, radiation pre-op, and then operating them.